the cloud, and that way, yeah.
Okay.
And then you'll
Start
get a notification when
start
the
AI
recording is.
companion. Okay.
Sure.
Sure.
Yeah. And that way Robin can either read it or you can send her the video when
Oh,
it's rendered and the
okay.
link to the video. Yeah. And then she can choose
Pops
whichever
up.
one.
Awesome.
Yeah.
All right. So I'm going to read this question again.
Okay.
If you learned about demand control schema in the past, you probably started at the beginning with demands and controls. While this training series is not solely focused on DCS, it is focused on the normative concepts of teleological decision making or values based decision making. As I've mentioned, that is what DCS basically is. In this approach, I started instead with consequences by listing the proposed set of values that interpreters should be basing decisions on. To what degree has this different approach to values-based decision making helped your understanding of DCS? Um,
Awesome.
so what I was starting to say is that values-based decision making is actually something that I refer to all the time in my thinking process. Um,
Hmm.
at- so learning that is like a simple shorthand in a way for just an umbrella for uh, working out different complex or ethical decision making.
Yeah.
So I feel like that, and I think that Robin talks about later that if she could do it again, if she could start all over again, she would put this at the beginning. And I think,
Hmm.
yeah, that is helpful because I feel like that is the container under which DCS um kind of
Why it was created in the first
fleshes out.
place.
Hmm.
Yeah. Yeah.
Yeah.
When I was an undergrad, I was a psychology major and I volunteered for pretty much my entire college career at a crisis hotline in Tallahassee. And we were taught, it was a suicide hotline actually, or crisis
Hmm.
hotline. And a lot of the
Hmm.
calls that we got were suicide attempts. And so we were taught this framework for how to speak to the people in crisis. And the group of us that had this training, I'm still friends with a few of them, and we talk about it was TCRS was the name of the crisis hotline, Tallahassee uh, Crisis and Referral Service, I think is what it was
Hmm.
called.
Hmm.
And so we turned it into a verb. And so, we've talked about how we have kids now and we're married now and all the things. And, have you TCRS your husband today? Or something like that, and it was basically, we, you reflect whatever, when somebody's like, you reflect, oh, so it sounds to me, you use I statements and, so it sounds like what you're saying is blah, 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 blah. And
Hmm.
so, which is all very therapeutic type, counseling type behaviors, but
Hmm.
it been integrated into how I
How you
talk to
function
people
in the
as a
world.
manager, how I function
Yeah.
in, yes, exactly,
Hmm.
in all parts. So I feel like DCS is very similar, and thinking
Hmm.
teleologically absolutely is the foundation for almost all my decisions, at least at work for sure.
Hmm.
um yeah.
Hmm.
Why I do what I do, and yeah, I'm even thinking about so I interpret at church, and I'm Jewish, and I remember a deaf person coming up to me once saying, I absolutely hate it when non-Christians interpret at church because I can always tell. And I was just like, oh yeah, I'm sure that really upsets you. And meanwhile, I'm like, you know, so can you
You were
tell?
using that's like, oh, I hear you. You were
I
using
hear
the
exactly my
I
TCRS,
hear what,
right?
yeah, I hear what you're
Oh,
saying. Yes,
so what you
yes.
mean
Let me,
is, so
right.
right,
Let me validate
yeah,
you. Hmm.
uh-huh, exactly. But so I've thought about even the way I interpret some of the worship music, I think about I'm not having to make critical decisions with life or death decision making, but I could interpret, the people that are sitting in front of me are PSE. So I could do word, word, word. But thinking about it from just a values based approach, should I put in the extra work to interpret this in a more um, in an ASL manner that's going to really show them the meaning of what's being
Mhm.
said.
Mhm.
I don't have to do that because the people that are in front of me are more English based,
Mhm.
but I I know they understand ASL.
Mhm.
So I'm gonna do the extra work to interpret it in a way that so they
There's a lot
actually.
more there's a
Yeah.
lot more depth and
Yes,
meaning
exactly.
when you're putting it in ASL, it's
Yes.
more
Yeah,
dimensional.
exactly. And so my decision to interpret that way is based on if I could use the four core principles, I would say it's based on um I guess justice. I want them to have equity,
Mhm.
and the hearing people get that dimensional, they get it through the tone of the music.
Right.
So
Right.
yeah. So I feel like
Right.
I'm, even though it's not a critical decision, I'm still
Yeah.
applying some teleological thought to that.
Thinking. Yeah.
Yeah.
Yeah. So should we move on to question two?
Sure.
Question two. Teleology in professional ethics requires the study of two components of the practice situation: the context and the consequences. Interpreters, when explaining or justifying a decision, will naturally identify three things: contextual factors, the positive consequence they were compelled by, and the negative consequence they were trying to avoid.
Mhm.
If you listen to the DI case again, you can hear the pattern. It will sound something like, I answered the attending directly because contextual factor. I also wanted the attending to positive consequence. And if I didn't, then negative consequence would likely occur. Over the next few weeks, listen for cases from interpreters, see if you hear these patterns. This is an excellent starting point, but is not a complete analysis. You need all the relevant contextual factors, concurrent demands, and you need the positive consequences, prioritized values, and negative consequences, forfeited value, which is part of the reasoning skills interpreters need to develop.
Mhm.
So I guess there's an ask in there of to use this thinking or to keep this in mind as we're working.
Mhm.
Um, but I don't know if we want to just talk about um, I mean, we could talk about that, the DI case.
Um,
And I wonder if that would go with the, hold on, when you first heard the case of the designated interpreter, maybe this would go along with question three,
okay.
and we can just go to that. When
Read
you first heard,
question 3. Yeah.
so when you first heard of the case of the designated interpreter, what was your reaction to this interpreter's decisions to respond directly to the intending? Most react with concern due to the deviation from our quote unquote best practice of just interpreting the question to the deaf person. Did your initial reaction change when the concurrent demands were identified? I am wondering about any shift in your thoughts about this interpreter and her case. And you can listen to a further deconstruction I have done with this case, including further analyses here. Um, I I think we've all had this exact scenario over and over again. Um, and I think it's all a case by case decision of what is who the people are, why you may or may not um go ahead and speak directly, or you may or may not go ahead and answer, or you may or may not go ahead and interpret. Um, and I guess you're just sort of weighing out the resulting demand that you might have created.
hmm I
Um,
just finished doing a VRI assignment. It was an educational assignment,
mhm,
and it's for a graduate level class.
mhm,
And I think it was optional for the students to attend, um, because some people attended and some didn't. And my student, the deaf student, had not shown up yet, and it was all done through VRI. Um, and the instructor addressed me, and we kind of worked out. There were other students that happened to be in. We worked out before deaf student arrived. Um, some of the details about whether or not I'd keep my camera off, and that I'm here listening even if I don't have my camera on, and that I would pay attention to the cue and see when the deaf person arrived and that kind of thing. Um,
mhm,
so I almost and then she addressed me directly even after the deaf person arrived.
mhm,
So it was so I almost felt like I was, she, of course, she didn't ask me my opinion about anything, or I wasn't involved as a student in any way, but it was, um, but I'm not just the silent interpreter as is traditionally thought. I
mhm, mhm,
was definitely acknowledged as, um, a decision maker, I guess,
mhm,
in some way. So Whereas I felt comfortable interacting with the teacher, the instructor, in
mhm,
a way that I think I may not have felt comfortable early on in my career.
mhm.
So,
Because you're not
um,
sure what you're supposed to do, or it's like,
mhm. Is this okay that I'm
is
having this
is this
conversation,
okay?
even though the
Right,
deaf person's not here yet? And then do I need to
right,
explain what just happened when the deaf person arrives?
right,
And I didn't. I
right.
didn't. You know, I did. I
Yeah.
just picked up where we were.
Mhm.
So yeah.
Yeah. Yeah. Yeah. I feel like the spectrum of conservative to liberal, and also looking at like the values of the institution, or like whatever,
hmm
whomever you're in whatever institution you are interpreting for, like what is the goal here? And
hmm
it just really
Right.
helps guide you to, making a professional decision.
Right. And I think as I've become more confident, as I've, aged and been in in this field longer,
Hmm.
um, I definitely am much more liberal than I had been initially.
Hmm.
Like even fingernails, like I remember being like, you should never ever paint your nails, and you should definitely not have long nails. And now I'm like, if you've got your nails painted, I mean, I wouldn't do bright pink, but
Hmm.
if you want to have a pretty color on your nails, it
Hmm.
it's not and there's nothing that I've come to anymore that's an all or nothing. Whereas there was a period of time where I was like, you're an interpreter, you should never have your nails painted.
Right,
So yeah.
right, right.
Um,
Yeah, I
so
think that's
yeah.
it. Just like that, it's not the rule, or the all or nothing rule,
hmm
that I feel like being in the program and just doing that really liberated me
hmm
to, feel confident. I guess liberate is maybe not the right word, but enabled me to
No, I think
feel
it's
okay.
actually a really good
Actually,
word.
maybe,
I
yeah.
think it's very applicable. Because I agree with you. I think that this framework has is very liberating, because now I can articulate why I'm making the decisions that I'm making in the same way that a physician would be able to articulate the reason why this is like I'm having hip replacement surgery in a couple of weeks, and my physician can clearly explain why I'm not going to be put under general anesthesia, and why they have decided to go, they gave me the choice. Do I want a general anesthesia, or do I want an epidural and light sedation or whatever?
Hmm.
Um, and after he was able to explain to me the two options, I was autonomous enough to be able to make the correct decision, or
Wait, did you
the
go,
decision that was right for me.
are you going to the epidural? Or are you going to the under?
I'm gonna,
You're,
so
you're going to do the
from the
epidural?
patient perspective, like my
Mm-hmm.
first response was, holy shit, you're gonna do the surgery and I'm not gonna be like fully out. But if I think about it from a healthcare perspective, knowing what I know about healthcare, there's less risks involved when you're not under general anesthesia. I'm going to be up and awake faster if they just use propofol.
Mm-hmm.
Um, I've only had an epidural once, but I didn't have any negative effects from it. It worked
Mm-hmm.
fine.
Mm-hmm.
I'm not overweight. I don't have all these extenuating complications that would make it difficult for them to put in the epidural.
Mm-hmm.
Um, I know that they do nerve conduction tests to make sure that you really truly can't feel anything. So
Mm-hmm.
I know enough about this healthcare system. I've done research on the doctor, like I've done all my homework that I feel like I could make an educated decision. I'm gonna go with and that way I should be in and out of PACU much quicker. I should be in discharge. I'll be doing stairs within, I don't know, a couple of hours after having this procedure done.
Really?
So, mhm,
Wow. Oh,
yeah, I'll be home
wow.
by
Okay.
lunchtime. Yeah, I know. Yeah,
Okay.
yeah.
Okay.
Whereas if I had general anesthesia, there's always, is her blood pressure going to regulate and how it's going to be a little bit longer and it's harder to
Right.
wake her up and, the possibility of having to do an overnight stay is a little bit higher and there are all these other. I remember when I was a doula, I remember telling patients one intervention causes the next when you're pregnant.
Mm.
When
Mm-hmm.
so if you can bear through the labor and not go, oh my gosh, I've passed my due date. I need to hurry up and get in there
Yep.
and
Got that
it- that,
Pitocin.
yeah, right. Because one intervention causes the next. And so I
Mm-hmm.
kind of feel like this too. As long as I don't smell it or hear it or taste it or feel it, I think I'll be okay.
And Robin, we're totally diverting from
I know, totally.
the
Right.
but
But
wait, is that the
that brought
29th?
me back. So we were talking, it's a 28. Yeah, the
28. I'm
28.
putting that, I'm gonna check in on you.
Oh, thank you. You're the best.
Yeah.
Thank you. But 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 back to the point of this being liberating, I feel like the
Yes.
knowledge I have gained from this framework is very liberating in my ability to make decisions as a professional and allows me to make decisions that hopefully will result in the patient or the deaf person being able to be more autonomous about whatever is going on with their situation. And
Hmm.
so I'm applying the same teleological framework to the doctor giving me the choice of general anesthesia versus light sedation. Um, and he was able to explain why, and then I was able to be autonomous. And the value there is he's valuing the fact that I'm young and I want to get up and moving as quick as I can. And
Hmm.
and there are less medical risks when you do it this way versus that way.
Hmm.
So he's being teleological, thinking about my well-being, my autonomy, using all the four core principles. The same thing.
Right.
Yeah.
Right.
Um,
Right. And if it was just rules based, or I guess deontological
mhm.
framework for the doctor, maybe even going under like
Right. I
insurance
treat
company
all hip
demand
replacements the exact same
the
way.
exact same way.
Everybody,
And
right,
yeah, or the insurance company will only pay for this, so that's how it goes.
right,
So yeah.
right.
Yeah,
Instead, we'll
this is
go
so
through
much.
pre-approval or whatever, whatever they,
Hmm.
yep.
And there's choices and
So
we can think through
even
things.
even the size of the ball that they're using, he and I
Hmm.
discussed that. I said, I'm very active. I was like, so is there anything I won't be able to do? And he said, well, I don't really want you to extend and rotate at the same time. And I was like trying to visualize that. And I'm like, so does that mean I can't do roundhouse kicks? Not that I do kickboxing anymore, but like I'm picturing what does that look like? Oh, it's a roundhouse kick. So I can't do that anymore. And he's like, actually, now that you mention it, I think I'm going to use a bigger ball because your risk of dislocation if you were to do something physically active is less if I use a bigger ball. So I was just like, okie dokie, you know.
All
So even
right.
having this whole discussion, not all hip replacements are exactly the same.
Right.
So
Right.
yeah, so
Right.
it's
And
so
not all of
he's
these
thinking,
circumstances.
right, and our
Yeah.
work is the same thing, and not
Mm-hmm.
there is no one
Cookie cutter.
interpreting, never. Right.
Right. Right. And then
Yeah.
this framework allows us to discuss or talk about
Right.
how we're making this decision.
Right. And so
This is
if
so
the like
helpful.
back to that example of Robbins with the designated interpreter, you know, had the negative consequence or well, there's always negative but had I'm not saying it right. Had this not gone the way she wanted it to, um or she was trying to prioritize one value and that the other value. Um,
Mm-hmm.
but had things not gone the way she expected them to go, she would have had to quickly pivot, is was what I'm trying to say. It's been one
Mm-hmm.
of
Mm-hmm.
those days. So
And
um
it's
yeah,
after
and
dinner for you.
well, yeah, almost. So yeah, she would have to quickly pivot and but being able to explain to a psychiatrist, why did I have to pivot in this direction, or to you know, why did I choose to interrupt at that particular time, or why did
Mm-hmm.
I choose to you know recommend that you do teach back,
Mm-hmm.
um because I didn't, it's not like you to interpret anything, but I think you should do some teach back, or and
Mm-hmm.
how
Mm-hmm.
you bring that up, and it depends. I might bring it up with one provider by saying I think you probably need to do some teach back if I'm really familiar with that provider, whereas
Mm-hmm.
another provider I might be much more professional and a little obscure about how I say it, so they can
Mm-hmm.
decide, oh,
Mm-hmm.
that means I should do some teach back. So
Mm-hmm. Mm-hmm. Yeah. Right. So there's number 4 here. Let's see what this is. In your
okay.
interpreting work over the coming weeks, oh, this is another ask. Count for the what it depends on. Take any decision you make, whether to take action or not take action, and see if you can identify the concurrent demands. So it's almost like what we were talking about.
Hmm.
I mean,
Hmm.
demand can be sometimes be tricky to identify in part because it's so easy and we try to make it more difficult than it is. It's quite simply something that was said, like the attending asking how to sign thank you, or something that happens,
Hmm.
like being thrown a basketball. Try to build your
Hmm.
own constellations of demands a few times to get the hang of it. Yeah, so I think we kind of
Mhm,
covered that.
mhm.
Um,
This is another thing. I don't know if you can hear the dog barking in the background, but that's
Not
another
really.
thing. Oh, good. These are amazing earbuds. So,
That's why I'm on this like gaming headset because my dogs bark like crazy and this has some noise canceling situation.
yeah, these do too, which is great. So
Awesome.
but that in itself is, you know, whenever I'm in a meeting at work, I always have my mouse hovering over the mute button just in case I need to quickly mute. Um, or you know there so I choose, do I allow the dogs to keep barking with my office door open and just mute myself, or do I wait for just the right time to hurry up and hop out of my seat, slam my door shut and sit back down again? You know, is it appropriate for me to actually be out of camera view for a hot second? um I love interpreting classes on VRI way more than VRS, because on classes, it's typically a lecture. And
Mm-hmm.
so I put noise cancellation on. I can't hear anything around me anyway. I get to interpret no matter how crazy they're barking. And it doesn't matter because I'm on mute and I'm just interpreting the lecture.
Mm-hmm.
Whereas if I'm on VRS, that is the most stressful thing. And the paralinguistic demand, not paralinguistic, the intrapersonal demands that arise in me make it so it's way too stressful for me to even bother. I don't want to do VRS at home anymore because
Hmm.
I'm so I don't look professional. My dogs are barking. This is,
Yeah.
there's all these inside. I'm doing all this about
Yeah.
how horrible this is.
Oh God. Yeah. I totally get that. Yeah. Right.
Hmm.
And then there's a professional decision to just say, not for me. No,
Not
thank
doing it.
you.
Right.
Not doing
Exactly.
that.
Right.
Yeah.
Yep. Yeah.
So
So, and I love that COVID has made it so if your dog barks, people are like, meh.
it's so great. It is so great.
Uh-huh.
But I
Yeah.
have to say it's disturbing for I do the same thing as you because I'm just like, oh my God, this is so unprofessional. And
Yeah.
I it's me. Like I can't handle it. Even if everyone else is like, no problem. It's like,
Right.
no, this is really disturbing me.
Right.
Yeah. Then I throw them
Yeah.
outside and they're like,
Right. The whole time. And you're like, oh my God, I'm going to need to replace
God.
that door in a minute. Yeah.
Yeah, exactly.
Yeah. Well, and
Exactly.
then the other thing for me is I work from home because of the administrative role that I have,
Hmm.
but I don't necessarily want to advertise that I'm working from home because even with my team, I mean, they know that I tend to work remote, but I love the virtual backgrounds that you can put on. So I'm
Hmm.
in the
Hmm.
little office that says Wellstar up in the corner, and you can't, or I have
Hmm.
and it's blurred, so you can't really
Hmm.
see a whole lot of what's going on behind me. And I really prefer that because I don't necessarily, I mean, it's commonplace, but I don't know. I just think it's better if people think that I'm in an office. And then the moment my flipping dog barks, it's definitely given away I'm not in the office.
Right.
So, yeah. So
Right. We
it's
share a wall with an animal shelter. I don't know what this is. It's like we had to rent this office. I don't know.
yeah. Yeah. Oh my gosh. Yeah, so I think about all those additional demands with even decisions like that.
Yeah.
Yeah.
Yeah,
Hmm.
exactly.
Hmm.
So I'm gonna need to wrap up because I have to take off to go to Costco to buy food for
Good.
this
Yeah.
camping trip. And
Awesome.
um,
Okay. Feel free to stop recording
okay, I will
and
stop
we'll say our
recording.
goodbyes. Yeah.
Okay, where is the stop recording? Pause stop
Gosh, it
recording.
just
Boom.
started pouring here. Cats and
Oh,
dogs.
nice.
Yeah.
Are you sure you want to stop recording to the cloud?